Hello, this is Dr. Radley, family physician in St. George, Utah, and July is UV Protection and Awareness Month. I'm talking to you about this because July here in St. George is a hot month with lots of sun rays and exposure, and we need to do everything that we can to protect ourselves from that UV exposure to prevent damage and health consequences. In the states here in Utah, particularly, this is probably the highest time of the year that we have UV exposure, but UV protection is not just about the summertime. UV protection really should be done year-round. UV, or ultraviolet light, is a form of non-ionizing radiation that primarily comes from the sun. We do get UV exposure from other forms of light sources as well, such as fluorescent or incandescent lights, mercury vapor lighting that can be found in school gyms or stadiums, the old big lights that are round that you see there, some halogen lights, and also some forms of lasers, particularly used for medical devices, but are primarily also found in tanning beds. There are three types of UV rays, UVA, B, and C. They're all primarily coming from the sun. UVC is 100% blocked by the ozone layer, so we have no UVC rays that make it to the Earth's surface that we need to worry about. The UVA rays are not blocked by the ozone layer at all, so UVA rays do completely 100% from the sun make it to the Earth's surface. UVB rays do get blocked by the ozone layer, but not 100%. So we also do have to worry about UVB rays and exposures, which is actually the most aggressive and most harmful form of UV exposure that we get from the sun. Each of them have their own specific wavelength. UVA is 315 to 399 nanometers. UVB is 280 to 314 nanometers, and UVC is 100 to 279 nanometers, the lowest or smallest wavelength, again, which is completely absorbed by the ozone layer and atmosphere and does not make it to the Earth's surface. The reason why we're talking about this is because there are risks that come from having a UV ray exposure. And the first thing I want you to be aware of is that there are some products, specifically oral and topical antibiotics, certain acne medications such as benzoyl peroxide, certain cosmetics, birth control pills that may increase the skin's and eye sensitivity to UV rays and skin absorption. UV rays in short term will cause a sunburn, which again, this is a burn, just as if you touched a heating element, and can cause direct skin damage. In the long term, UV ray exposure can lead to premature aging. I'm sure you've all seen someone who you know has had a great deal of sun exposure in their lifetime when their skin is very dark brown and leathery and dry looking. It can also increase your risk of skin cancers, primarily squamous cell cancer and basal cancers, but any form of skin cancer, particularly even melanoma, which is the most deadliest form of skin cancer that there is. Skin cancer is the most common form of cancer in the United States. Skin cancers in themselves actually outnumber all other forms of cancer combined together. And again, the melanoma is the most aggressive and deadliest. Skin cancers primarily happen in areas of high exposure, so particularly around the face, ears, nose, mouth, and also don't forget the nape of the neck. A lot of people, particularly men who have short hair, might be outside working a lot and their collar may not completely come up and cover the nape of the neck, and so they're at high risk for cancers on the neck as well. Anyone can get skin cancer, but it's more commonly seen in people who have a high amount of sun exposure. That's obvious. People who have a family history of skin cancer, and people who have very fair skin, hair, or eyes, because they usually have less melanin in their skin to help absorb some of that sun UV exposure. And also, you're going to see it more in people who are over the age of 50. That's because of the accumulation of the UV exposures over time and when the cancers finally will manifest. UV exposure can also cause significant eye damage and particularly blinding eye diseases. For example, macular degeneration, which is a disorder caused by damage to the backside of the surface of the eye called the retina. That is a leading cause of age-related blindness, and again, a high amount of UV light exposure increases your risk of developing macular degeneration. You can also develop cataracts, which is a clouding of the lens in the front of the eye. About 10% of people who have cataracts, it's thought to be directly contributed to UV ray exposure. That can be treated by replacing the lens in the eye to prevent blindness. Pterygium, often called surfer's eye. It is a fleshy pink growth of skin that comes from the outside. It covers over the white part, the conjunctiva, and will eventually grow over the colored eye, maybe even the iris, and obscure the vision. You can be at increased risk of skin cancer directly around the eye and on the eyelids itself. And you can also develop photokeratitis, which is also known as snow blindness. This is a inflammation in the eye, which is painful and can cause temporary blindness if you have enough direct exposure to sun, particularly UVB rays, for a short-term period. This is usually from long hours of being on a snow surface, such as snowboarding, snow skiing, snowmobiling. You can also see it in people who spend a lot of time at the beach. This is primarily because of the reflection of the sun rays off of the snow or off of the sand in the beach. To protect yourself from UV rays, the first thing you can do obviously is stay indoors, but we don't want you spending your entire life indoors. We want you to be able to get out and be active and have a productive and healthy life. So that means that we need to be smart about our UV exposure and making sure we're using the right kinds of protection. So if you're going to be outside spending the day, ideally we'd like you to be under some form of shade or shade coverage versus being in direct light. And ideally, specifically try not to be in direct sunlight between the hours of 10 a.m. and 4 p.m. when the sun's rays are usually the strongest and the most direct. A simple test to be able to tell if you're in the peak hours of sunlight exposure during the day is by using the shadow test. If you're standing in direct sunlight and your shadow is not as tall or taller than you are, then you know that you're in those peak hours of the day where you're getting more aggressive direct light exposure. We often think about sun exposure and increased risk of sunburn as a specific day. We're going to go spend a day at the beach or a day at the lake or something along those lines. And so we think about coverage at that moment of time. But UV exposure is an accumulation over time. So you have to think about it on a day-to-day basis. If you're out working in the yard, working in your garden, any kind of time that you're spending out exercising are all times when you should really ideally still be thinking about sunscreen and UV protection. A lot of times we also think if it's hazy or cloudy outside that we don't have to worry about UV exposure, but the UV rays in the sunlight do still penetrate through the clouds and the haze, and we can still get a sunburn or direct exposure from that if we are not doing things to protect ourselves. So you have to take that into consideration. Just because it might be cooler at a particular time of year, such as spring or fall, also does not mean that you're not getting UV exposure. Or just because you're in a place where you might feel cooler, such as being in the water, does not mean that you're not getting UV exposure. You can still get sun rays through the water and still get a sunburn even in the water. And you might be staying indoors to try to avoid direct sunlight, but if you're sitting inside indoors of a window where there might be a very well lit window in that direct sunlight, if the glass is not rated for UV absorption, you might still be getting direct UV lights even through the glass. So this can apply whether you're in your house or in your car driving, you may still be getting UV damage. It is not uncommon for me to see people in my office who have an asymmetrical aging on their left side of their face if they're someone who has to spend a lot of time driving in their car. And also you need to think about it if you're propping your arm up on the side window of the car. Both of those areas are going to be getting increased sun exposure and can still have UV damage. Now, most glass in cars in particular do have chemicals in there or a layer of protection that does help with UV absorption, but it's not going to be 100%. It also may depend on the degree of tinting that is in your car. The greater the degree of tint, the more of the sun rays that are absorbed and aren't going to come through the car window and will decrease your likelihood of having UV exposure. However, you need to check your local laws as to the level of tinting that is permitted in your area so that you don't receive an infraction. If you're planning on spending a lot of time outdoors, you might want to check the UV index in your area. This is something that can be done on the EPA's, Environmental Protection Agency's website, or a lot of times you can find on your local weather station. The UV index is going to be dependent on a number of factors. It's going to be dependent on where you are on the Earth's crust, so your location and geography, the time of year, depending on how your location is directly tilted towards the sun from the Earth's axis or not, and also the altitude. The higher that you are up in the atmosphere, the less protection that you're going to have. So everybody's UV index is going to be different depending on where they are in location and time of year. A simple way to remember what we need to do for UV protection is seen on the CDC and American Cancer Society's websites, and that includes slip, slop, slap, and wrap. So slip on a shirt or covering of clothing, slop on some sunscreen, slap on a hat, and wrap around those eyes so that we have that protection. So let's first talk about clothing. Ideally, we want to be wearing clothing that has a great deal of protection from the sun. So that's going to be things such as wearing long sleeves, wearing long pants, long skirts versus short sleeves or shorts, or minimal clothes such as a bikini or swimsuit. The other thing is you want to think about the type of clothing that you're wearing. Dark clothes are going to absorb more of the UV rays of sunlight than a light colored clothing. The weave of the product of the clothing is going to make a difference. The tighter the weave, the more absorption. And you also want to look for particular pieces of clothing or fabrics that have UV protection built in them. So this happens to be a specific sports or shirt ideally designed for fly fishing. This is my one of my outdoor shirts. I love this because it's lightweight, it's very breathable, but it has a very tight weave in the fabric. And this shirt actually came labeled with a UV protection, meaning that it's been tested and treated to offer UV protection from exposure. So it also, again, has long sleeves, so I'm getting great protection. But not all clothing is ever going to protect you 100%. So if you've been outside long enough for a long enough period of time, even with a long sleeve shirt on, you might have found that areas that have less material in them or layers of the material, you might have a low grade tan or sunburn through, whereas areas that have double layers, such as the placket or the sleeves of the clothing, you may not have as much as a sunburn and might actually kind of have a little bit of difference, almost looks like a tattoo of the shirt that you're wearing. So you do have to be aware that just because you do have long sleeves on or wear clothing that has UV protection factor in it, doesn't mean it's going to still protect you from the sunlight 100%. When you think about your clothing, a general rule of thumb is if you can see through the clothing, then so can the sun's rays. The other thing is a lot of times we'll wear clothing to help reduce our sun exposure. Because I am fair-skinned, usually when I go out in an area of sunlight for a long period of time, such as to the beach, I will usually wear a swim shirt to help reduce direct sunlight on my skin to prevent burns. But when your material and your fabric gets wet, you again have a higher risk of the sun penetrating through versus when the fabric is dry. There are now products that you can get that you can treat your clothing with to help increase the UV protection, and certain things like laundry detergent sometimes now will have chemicals that when you wash your clothes, they will also help increase the UV protection on your clothes. So that's something that you might want to be checking into as well. The next part is slop on some sunscreen. So we need to talk about sunscreen, what that really means, how to use it, to make sure you're using it appropriately. So sunscreen is a product that you put on your skin to protect it from the sun's UV rays. Sunscreen is just a filter. It's not going to protect you 100%. It's just another layer. So ideally inside or shade layer with clothes, and then sunscreen as well as another layer of protection. Sunscreen is not ideally just to say, well, this means I can be in the sun longer. We still want to use those other preventative techniques that we've talked about. And again, you want to use your sunscreen properly. Make sure you're getting the right kind of sunscreen. Sunscreens now come in many forms. There's lotions, creams, ointments, gels, sprays, wipes, lip balm, to name a few. A lot of times the lips are neglected. We don't remember to put on lip balm with sunscreen, so that's something that you need to really particularly pay attention to. Also, a lot of times when you're using cosmetics, your moisturizers, foundation, powders might also have a sun protection factor rating in them as well. So that's something that if you're going to spend a lot of time outside, you might want to be checking into also. When selecting a sunscreen, you want to make sure that you're doing your homework and make sure that you're purchasing products that are going to be labeled appropriately, that you know have the testing done to make sure they're going to provide the protection that you need. So ideally, a sunscreen that's going to be labeled as a broad spectrum sunscreen or be specifically labeled for UVA and UVB protection. Again, you're going to get both wavelengths coming through the ozone. Even though UVA is in more abundance, UVE is more harmful, so we want to make sure that we're getting protection from both. There are sunscreens out there that will be labeled specifically for UVB protection, but may not have anything rated for UVA protection, so you need to make sure that you're looking into that. When you purchase a sunscreen, for it to be labeled broad-based or broad spectrum sunscreen, it has to be able to protect against both. The next thing is the sun protection factor. For a sun protection factor 15 or less than 15, products are now required to carry a label stating that they do not protect against UV sun's rays, which does not protect against cancers, aging, or damage. So you need to have a minimum of SPF 15 rating to even offer any protection at all. Ideally, you want an SPF of 30 or greater. So let's talk about what that really means. An SPF of 30 primarily means that with that product applied appropriately in the right amount, it will give you sun protection factor in 30 minutes of sun exposure that will now equate to you of having the equivalency of 1 minute of unprotected UV ray exposure. So 30 minutes is equal to 1 minute of UV ray exposure. If you're out in the sun for 60 minutes with the SPF of 30, it means that that's going to be equivalent to having 2 minutes of UV unprotected exposure. So you get the idea. Also, the increase in the rating of the sun protection factor does not automatically mean that that number doubles. So let's talk about what that really equates to. So you can find products that are available now that you can get a sun protection factor as high as 100 or greater. That doesn't necessarily mean that it's going to offer you 100% guaranteed coverage of not having any UV damage, or that you're not going to be increased risk from the harmful effects from having sun exposure or UV damage. So a SPF of 15 will protect about 93% of UVB rays. An SPF of 30 will filter out about 97% of UVB rays. An SPF of 50 will protect or filter out about 98% of the UVB rays. And an SPF of 100 will filter out about 99%. Difference as the higher you go becomes very small. So again, having a product with at least a 30, you're still getting 97% of the sun's rays. Again, no sunscreen is ever going to protect you completely, so take that in consideration when you're looking at the product that you're purchasing. Some of them are chemical compounds that will inhibit the UV rays traveling through the skin. Other ones might be more of a reflective barrier that is reflecting the rays off of the skin. Sunscreens are no longer allowed to be labeled waterproof or sweat-proof because it's going to be misleading. They have to carry a labeling of water resistance or sweat resistance. And then they also have to state for how long you have protection for. So usually that's going to be listed as somewhere between 40 and 80 minutes. The other thing is you need to make sure you're checking the expiration date on your sunscreen. If the sunscreen product is more than 2 to 3 years old, it's probably not going to have the same chemical integrity as when you first bought it, which is not going to offer you the same protection that you think it's going to be offering you when you use that. The other thing is a lot of times the chemicals may settle in the product as time goes on, so make sure that you shake the bottle up to remix the sunscreen ingredients. And depending on where you store your sunscreen at, if you're leaving it outside for a prolonged period of time, such as in your boat, and it's been sitting out in the heat, the chemicals may be degrading, and so it may not even last as long as expiration. You might want to replace that sooner so that you make sure you're getting the protection that you really need. So I'm going to show you a couple of products that I personally use for my family. In my family, we spend a lot of time outdoors. We like to go boating. My kids play soccer and they like to go bike riding. And so they're exposed to the sun a lot. We also do a lot of swimming. So I try to use products that I hope that they're going to be willing to use because they like the products. My family particularly likes to use spray-on sunscreen. I personally prefer a lotion, even though it's more difficult to apply. I can usually tell where I have it on and make sure that I have a good layer applied. So here's a couple of products that I've purchased that I know my kids will usually use. I'm not necessarily endorsing any product. I'm just showing you that these are products that we have tried and that we've liked, so we continue to use them. The first one is Copper Tone Sport. Again, because we spend a lot of time around the water, or what we're doing a lot of time involves sweating. This is a great product. It does have a broad spectrum, so again, UVA, UVB. And on this one, it specifically even states that on there, UVA and UVB. This one has SPF of 50. So again, it's not going to be 100%, but it's going to be the majority of the UV rays. Again, this would still require to be reapplied every 2 hours or more frequently depending on how much time we're spending in the water. If you're going to be in the water quite a bit and get out of the water, you need to reapply when you get out of the water. This one does have a water resistance labeling. This one states 80 minutes, so it should be good in the water for up to 80 minutes. But again, if you're getting in and out frequently, you might need to reapply a little bit more frequently. Again, this one is really nice because it just sprays on really easily. It has a light coat. Sometimes it does feel a little bit oily when we put it on, but this has been a really good product for our family. The next one that we've started using this year, Alba Botanica Hawaiian sunscreen. I particularly like this one because it has a coconut smell to it versus the other sunscreen, which has a little bit more of just a chemical smell to it. Again, a very similar product. It is a broad spectrum, so it has both the UVA and UVB protection with an SPF of 50. It also is labeled water resistant and again is labeled for 80 minutes. The nice thing with this one, depending on personal preference, if you're a green-minded person, this one specifically states a reef safe, a biodegradable, no animal testing, and it's all natural fragrances. So that's another nice option. Here is a lotion version of that that I got to particularly put on around our face with SPF of 45. This one has more of a green tea smell versus the coconut, but otherwise the same factors listed with being water resistant for up to 80 minutes with both broad spectrum UVA and UVB coverage. This last product I want to show you is one that I've also used for years. I really love this product. I use it a lot under my foundation for my makeup. This is not one that you can find over the counter. This has to be purchased through physicians' offices who carry this product line, and this is SkinCeuticals Ultimate UV Defense. This has an SPF of 30. It is broad spectrum for both UVA and UVB. I really love this product because it is a barrier sunscreen with zinc oxide in it, and it has just a really nice feel about it. When you put it on, a really nice sheen, so I can wear it on my face. It's light, but it has a good reflection underneath my foundation when I put it on, so it helps to reflect light and it just gives a really nice glow to the skin. You want to make sure when you use sunscreen that you read the label and follow the instructions. Don't be skimpy on your sunscreen. Make sure you have good coverage everywhere. For a lotion or cream, a 1 ounce amount of sunscreen is typically enough to cover, for most adults, your face, ears, neck, arms, and legs. So 1 ounce is going to be about the amount in the bottom of a shot glass, or about the amount of a palmful. It's 30 cc's. So make sure that you're getting enough to cover well. If it's not enough, apply more. Make sure you get that good coating on everywhere. Again, sunscreen should be reapplied frequently. For most products, it's going to need to be reapplied about every 2 hours. And if you're going to be layering sunscreens with other products, as I mentioned with the SkinCeuticals product, I frequently wear that underneath my makeup. The sunscreen is going to go on before your makeup. If you're going to be using a product with an insect repellent, you want to make sure that you apply the sunscreen first and then the insect repellent product over the top of that. The next part is slap on a hat. Ideally, we want to be using a hat that has a wide brim, at least 2 to 3 inches around, and ideally completely around the head, so we're protecting the side of our face and the nape of the neck as well. Again, as we talked about with the material for your clothing, the tighter the weave, the better, so that those sun rays aren't filtering through. So you need to think about that if you're someone who uses a straw hat, which is very frequently done, or some other form of natural material that has a weave to it. The other thing is you might want to think about the type of material on the underside of the brim. So if you have a straw, that's going to be a highly reflective material versus if you have something that has a darker color to it, and that includes the hat material itself, using something like a canvas versus a straw, or something that has a darker pigment in it is going to help absorb the sun rays and have less light reflection. So that's also going to help with your eye protection besides just the reflection onto the skin. If you do not have a wide brim hat that goes completely around your head, if all you have is, for example, a ball cap, you can easily modify that using a bandana, where the bandana can go underneath the hat and cover the sides of your face with your ears and the back of the nape of the neck as well. Or you can find particular hats that are called shade caps that already have that material built in to cover the sides and the back of the head, but still have a ball cap or brim type hat that you get to wear. So we're looking for something that's going to protect our face, eyes, ears, nose, and again the nape of the neck if possible. The last part is wrap, and that is our glasses. Wearing sunglasses that wrap around the face to help reduce eye exposure and UV damage. Again, we talked about the conditions that can come from UV damage to the eyes, macular degeneration, cataracts, pterygiums, photokeratitis, or the cancers that can develop around the eyes and the eyelids. So we need to make sure that we're protecting our eyes as well. Ideally, your sunglasses should block about 99 to 100% of UVA and UVB rays to minimize exposure. Most of those will be rated with ANSI and ANSI certification. If it states it meets UV requirements or UV exposure, it usually is going to do that. Or it may be labeled UV absorption up to 400 nanometers. Again, the wavelengths of the light from UVA, B, and C do not go above 400 nanometers, so that's going to make sure it's capturing the majority of those rays coming through. If they are labeled cosmetic, and then they are only designed to block up to 70% of the UVA and UVB rays. So you might want to take that into consideration with looking at the labeling on your sunglasses. If they do not carry a label at all in regards to UV exposure, they probably are not designed to absorb UV light, and so you're not really protecting yourself. Even though sunglasses might look cool, maybe you need to rethink what you're purchasing. Ideally, all eyewear should have some form of protection in there against UV rays. That includes your prescription sunglasses. And also, most contacts these days are also made to help absorb UV rays for that extra protection. But again, they're not going to cover the whole eye, so you need to take that in consideration when you're thinking about wrap and trying to have something that covers all the way around. Darker glasses also do not automatically mean that they have an increased absorption. Even though we did talk about the darker material with clothing, the UV absorption in your glasses usually comes from a chemical treatment or something built directly into the product of the glasses, and not necessarily just the coloration. And so don't make an assumption just because you have darker glasses that they are absorbing more of that UV ray exposure. They might help as far as the glare of the sun, but may not necessarily be giving you the protection that you need. Now I'm going to show you a couple of pair of glasses that I have. So again, on a wrap, we ideally want something that's going to wrap completely around the eyes for protection. This pair of sunglasses I probably have had for about 10 years. This has been a great pair of sunglasses. These are made by Oakley. I love their products. One, because of the wraparound shape, but their products are very, very durable. They're made to last. Like I said, I've had this pair probably for about 10 years. I have replaced parts of sunglasses, which is again something I love about the Oakley products. I have replaced my nose piece and my ear pieces at one time in the time that I've had these, and they do allow you to purchase those to do that with, but they are usually designed to be very scratch resistant. And they are all rated for UV protection. You can actually go onto their website and they'll tell you exactly what the rating is for every pair of glasses, because they're designing their glasses for your eye protection, not just so that you look cool in them. But this has been a great pair of glasses. I'll go ahead and put these on. These glasses I take to the lake all the time. Again, they offer a great wraparound protection, so I'm not getting a lot of glare on the side of my eyes. They're very comfortable, they're very lightweight. I've actually used these glasses in Tough Mudder and Spartan competitions, and they have endured very well. So even though they're more expensive, they're worth the investment if you want to save your money up and buy a good pair of UV rated glasses that are going to be durable, and then just take good care of them. You know, they have a cleaning cloth, they have a case that comes with them, so if you take good care of glasses, they'll last a long time. This is another pair of glasses that I bought that has a UV protection. Again, even though these are more of a dress pair of sunglasses, you can see that they have a wraparound as well. So I use these quite a bit when I'm going out, depending on the activity. If I'm going to be more at a social event versus being at the lake or doing something sporting. So I'm going to put these on too. Again, you can see how these wrap around the side of my face, and also the ear bar here has quite a bit of a thickness, so it also prevents glare coming in from the lateral side of my face. So this offers a great protection from exposure all the way around as well. I love this pair of sunglasses. I probably have had these probably as long as my Oakleys as well. Again, make a good investment in a good pair of sunglasses and take good care of them. And speaking of sunglasses, we also need to think about our children, particularly our young ones. They're outside a lot, they're playing, they too need protection. And a lot of times we'll give a kid a pair of sunglasses, but it's usually a children's toy pair of sunglasses, and that's not going to give them any protection. So we do need to protect our children's eyes as well. So think about investing in a good pair of sunglasses for your children if they're going to be spending a lot of time outside also. And then again, not only thinking about our children's eyes, but also our children's skin. Our kids are dependent on us to make sure that they're getting sunscreen in, particularly if they're younger ones. And their skin, being younger, is more thin and is more susceptible to UV damage exposure, so higher risk for sunscreens. We want our children to be outside, getting in the dirt, playing, being active, expending all that energy so they're not wearing us out through the day. So make sure that you're protecting your kids. Get them a sunscreen on. Make sure they have long sleeve clothing if possible. Make sure they have layering. Ideally have them play in a place where there's some shade outside. And make sure that you're reapplying the sunscreen frequently. Now for those very young ones, for those babies 6 months or less, they ideally should not be in direct sunlight exposure at all during the day. Their skin is so susceptible. So if you're going to have them outside, they really need to be under cover, under shade, and if you can, ideally even under a blanket under the shade so that they're not exposed to any other rays coming through. You also want to take the opportunity to teach your children about the risk of damage from the sun's rays and exposures, and about the importance of why they need to cover up and use sunscreen. The next part I want to talk about is indoor tanning. So there is no health organization that has recommendations for people to use indoor tanning across the board. We do recommend it in specific health conditions to help with their health conditions, but we do not have recommendations for anybody to use indoor tanning otherwise, particularly adolescents. We have very good data that shows that the earlier that you start doing indoor tanning, that's being defined as under the age of 30, and particularly as teenage years, the higher likelihood of developing skin cancer, and in particular the more aggressive and deadly skin cancer, melanoma. So we really ideally do not want to be doing indoor tanning if at all possible, to prevent the health risks that come from the increased risk of cancer, premature aging as well. If you do want to have that year-round tan look and you don't want to be doing the indoor tanning ideally, then you might want to consider tanning pills or chemicals, or even spray-on tan options to have that appearance of having that year-round tan without having the harmful side effects that come from indoor tanning. Now, there is an area of UV exposure that I also want to talk about. It is not indoor tanning, but it is actually the UV lights that come from having your nails done. So you can see that I too like to go get my fingernails done, but for certain products to be able to dry, they put you underneath the lamp to dry the product or set the product. And I have had women come in who are older and their skin is thinning as they're aging, and they have gotten sunburns on the back of their hands from being in the nail setting lights, because there is UV exposure from those lights as well. So if you're someone who's going to go get your nails done frequently, or when you're older and your skin is thin, you might want to consider at that last stage, as they're applying the polish, that you might want to put on some sunscreen onto your hands before they start having you set your hands underneath the UV lights. Now, as I mentioned previously, there are benefits to being out in the sun. We all need sun exposure to some degree to be able to have vitamin D develop in our skin. We need vitamin D to help with calcium and phosphorus absorption, to help build strong bones and reduce the likelihood of developing osteopenia or osteoporosis. However, this is an area that is still being studied, and there is no across the board recommendations for everyone on how much is enough sun exposure. Part of that is, again, you have to think about the UV index depending on your location, your altitude in the atmosphere, the time of year and the Earth's axis, as well as your particular skin situation. Depending on how much melanin or pigment that you have in your skin is going to really determine which amount of vitamin D sun exposure requirements you particularly are going to need. At this time, the World Health Organization does have a recommendation of between 5 and 15 minutes, 2 to 3 times a week for most individuals. But again, this is an area that is still being studied, and we do not know how much is the right amount for every individual at this point to be able to give recommendations based off of UV index, location, or skin types. And again, there are conditions that we do recommend UV exposure for medical indications. Again, this is an area that's going to be prescriptive from your provider. They're going to have a very specific treatment plan. And usually those are going to be conditions such as psoriasis, eczema, certain types of acne, rickets, vitiligo, and then certain cases of lupus. So across the board, there are not medical recommendations for having high levels of UV exposure. If we do recommend it, it is in a very specific treatment plan for specific conditions. So don't just think that that gives you carte blanche to be out in the sunlight all the time and without being protected. So I hope this has been helpful, and we want you to be able to be outdoors, have fun, but stay safe, reduce your risk of skin cancers from UV radiation exposure as well as the other side effects to your eyes, and try to have an active and healthy and productive life by getting outdoors and not just hiding inside all the time. And until next time, this is Dr. Radley, family physician in St. George, Utah. Pura Vida.